be looking at the appendicular skeleton, and we'll go over those components very briefly. And so this is going to cover about the first half of that, and that's going to be the pectoral girdle and the upper limbs. So we've got four main sections to the appendicular skeleton: the pectoral or shoulder girdle, the upper limbs, which of course is the arms, then we have the pelvic girdle, which is where your pelvis is, and the lower limbs. There's about 126 bones that make up the appendicular skeleton. Many of these are paired, they're bilateral, and so it sounds like we're learning a whole lot, but this is actually, I feel, an easier, shorter section than axial. Because the axial, the facial bones are just so, there's so many of them, so many features. Anyway, so there are about 80 bones in axial, but there was a lot to learn there. About 206 bones total in the complete human skeleton. That's actually an average. You'd be surprised at the number of differences that people can have. All right, so here's the full list, guys. So you really should be studying and being sure that you know everything that is on these lists, that list of structures to know. That should always be your starting point, all right? If it shows up on the test and it's not on this list and I haven't made a huge to-do over telling you to add it to your list, then you better tell me, because I owe you some credit. You deserve some more credit. But if it's on this list and you say, hey, we didn't cover that, I'm sorry. If it's on this list, you got to know it, all right? I try to be as thorough as I can and make sure we cover everything. But students still sometimes say, well, I've never seen that before. But what that usually tells me is they're not studying. So be sure and sure that these are the list items that you are looking at on your APR and on your worksheets and practices. So we're going to start with the scapula, which is, of course, your shoulder blade. And then we have 6 features here we're going to be looking at. So really, the number of bones is smaller, and then they do have features on each bone. All right, so here on the left is the coracoid process, and it is pointing to the actual coracoid process, which kind of makes a little C, which is really handy. Now here on the right, I should have put an arrow on here, but it's right there. There's your coracoid process there, all right? So that's a pretty easy one to remember if you can just remember the name. And watch your spelling. Some of you had some spelling issues. Most of you spelled everything really well, which is great, but some had a few. Might have been typos. I didn't count off this time because they weren't terrible, but it is very important because remember, this is where you can have medical errors occur. So learning how to spell these words correctly is important. So here we've got the suprascpular notch. Well, have you learned your word parts yet? What does supra mean? Supra means above, okay? And so this is going to be above or on the top of the scapular. And look, I was just lecturing you about words and I'm missing an A there, right? Okay, so, which is why I sometimes give you all grace. Suprascapular notch it's not really V-like, even though it is a notch, but you can see it there, and then you can see it here from a lateral viewpoint. It's like somebody took a little notch out of the bone. All right, so over here on the left, we have the acromion process. And you can go back and look at the other pictures for the opposite view, but it doesn't have that C shape, and you know, it almost does kind of have an A shape, but it's just really that kind of flat extension there that sticks out. Acromion process. And then we have this spine, and so I wanted to use the APR image here since we can't get our hands on this for you to really see that spine, because it is something that it's hard to see without it being in 3D, all right? So next we have the glenoid cavity here, all right, and that's where we may have some articulation going on. And then we have the infraspinous fossa. So a fossa is a depression, okay, almost kind of like a mud hole. It kind of sinks down, the sinkhole, but not very deep. Infra means within, so within the, or below actually, below the spine, and so it's a depression below the spine on the scapula, okay? And so learning these word parts really, really help. I was thinking the difference between inter and intra, that's why I said the other with the infra, but infra is below, okay? And so if you know those words parts and what they mean, it makes identifying these things just easy peasy, all right? Well, maybe not easy peasy, but much, much easier. All right, so next here, you might not recognize this bone. This is the clavicle. What's the clavicle? Well, this is your collarbone, right? And so it's got an acromial end and a sternal end, all right? I don't think those are on the list, but you need to be able to orient these bones, all right? That's always really, really important. The acromial end has a small, flattened oval surface, okay? It's directed downward, all right? And that articulates with the acromion of the scapula, all right? The medial end is also called the sternal end of the clavicle, and it has a more triangle shape that actually articulates with the manubrium on the sternum. So that's where we get the sternal end from. All right, so the humerus, and what is this? Is this your funny bone? Is there a funny bone? I should make that a poll question and see what you guys tell me what a funny bone is. Might make you wait on that and see. Might make you wait till anatomy 2 to see what the funny bone really is. All right, so the humerus here, we've got lots of features because we have lots of muscles that need to attach, right? Muscles and ligaments that need to attach, so we gotta have features. And then we also have some articulation, so we gotta have features to have an articulation or a movement, right? All right, so we're gonna look at all of these. All right, so I put several of these on one slide here. On 3A, you have the greater tubercle, so it's gonna be the larger one. And you can see it's kind of a rounded projection there. All right, or bump almost. And then the lesser tubercle is this one here on the side that is smaller. Inter means between, so intertubercular or intertubercle basically. So between the tubercles, there is a sulcus, and a sulcus is a depression, all right? And again, I use the APR image because it's hard to see that impression in these pictures, okay? So between the tubercle, depression. And this is why for your extra credit, I wanted you to put all of these word parts on your flashcards. And let me tell you, extra credit in lab counts a whole lot. Here we have the deltoid tuberosity. And again, this is a point of attachment for a muscle. Can you guess which one? All right, so you can see here highlighted in green. It's very minute there. And I kind of covered it up, so let's see if I can erase that. All right, but you saw where the picture was, and then right there. And it's really just kind of, it just goes up, and that's even exaggerated. It's just a bump on the bone, literally. It's just like a bump on the bone. Deltoid tuberosity. So here we have the humerus, and you can see that this is the proximal end, which is nearest to the point of attachment, because that is a ball and socket joint, and so it must articulate. And you can't see the coronoid fossa on that side, but you can right here. And the fossa is, of course, a depression. So it's a depression there at the bottom. Now that depression here is actually above these epicondyles, and we have condyles and epicondyles. So what does epi mean? Epi means above. All right, and then we have lateral and medial. Lateral is to the side, and medial is to the middle of the body. Medial always means more towards the center of the body. And so here on the left, my little pointer here is pointing to the lateral epicondyle, and I want you to pay attention to how this bone is presented. If it is flipped around the other way, which side is that lateral epicondyle going to be on? It's going to be on the other side. So you need to pay attention, not just look at that at the bottom and try and memorize that, because if I rotate that or show you a different view, it's going to look different. I found a really good website to help with that as well. I am going to post that for you. I think the name of it is eSkeletons, but that will be in your resource tab. And you can rotate those, or you click a button and it moves them around where you can see these things. Then you can click another button and it puts all the labels. That, along with APR, will really help you learn to look at these in different viewpoints, okay? APR actually has a 3D section to it. So if you search for some bone names, they will come up and you can see them rotate around. They just don't quite have all the features on there yet. It's mostly just the major bones, but you can still rotate it around in 3D. If you have a touch screen, you can just take your hand and rotate it around. It's really pretty cool if you want to check that out. All right, so then we have the medial epicondyle. So this is going to be above the condyle. It goes epi, it's the epicondyle, and it's going to be towards the middle or the midline of the body, and that is, of course, where the blue line here is pointing. That is the medial. And so if we rotated that over, and you can see the ball and socket joint, or the ball and socket, the ball of the part on the head of the humerus, it would be on the opposite side. So pay attention to those other landmarks so you don't get lost, right? If you're in a new city, you pay attention to where you're going, okay? Right? We do that. Now, we don't do it as much anymore because we like to use Google Maps, but. All right, so here for 3H, we have the capitulum, and that is almost, to me, it looks kind of knuckle-like there. And then there's that olecranon fossa. Olecranon fossa, and it's pointing right here to the indentation there. I need another color. Indentation right in there is the olecranon fossa. And notice that is a lateral look at the humerus, right? Here, we're looking from the posterior side because it is facing, actually this is really more lateral. So anyway, pay attention to where you're looking and how it's oriented. That is very important. And look at things from different perspectives because I'm telling you, it changes. All right, so we're going to look at the ulna. All right, so the ulna, so we're looking at the arm next. We have the radius and the ulna. So we're going to look at some features here for the ulna. All right, so we have the radius and the ulna. And one way you can remember that if you're looking at two of these, it would be really handy if this was the side where the ulna was, but it's not. So I remember the radius is on this side, the ulna is not where it would be convenient, okay? And these do articulate and move some, so you have to be careful. But if you're looking at a skeleton, the ulna is not where the U is. That's how I remember it. You can find your own way to remember it, okay? And so here we have the head of the ulna here on the left, and I'm pointing to that with a pointer. Actually, I don't think that one's my picture. And then here we have the styloid process. And remember, a process sticks out, and a styloid is a little bit longer one. Like on the skull, it's very long here. It's not really long. It's kind of tiny, all right, but it is there. Then we have the trochlear notch, okay? And so you can see me pointing to it there, but right here is the trochlear notch, all right? And then the upper portion of that here is the olecranon process. Olecranon means elbow, okay? So this is where your elbow is. And then we have the coronoid process, which forms the bottom of a C-like structure here. So that's pretty handy. Then we have the radius next, and we're going to look at two features on the radius, the radial tuberosity and the styloid process. Remember, a tuberosity is kind of tube-shaped, and I've given you two pictures here to look at. You can kind of see it right there. And then this has it highlighted. It's kind of a little bump, again, that sticks out, but it's a little more tube-shaped bump. And then we have the styloid process here on the radius. It's not as elongated, but it does stick out a little bit there. Next, we have the pelvis, and I really like this picture because it shows you the pelvis all together along with the sacrum, and it highlights the three bones of the three portions of the bones that form each of your hip bone, each of your pelvis. Now, please do not put hip bone on your exam. That is not the scientific term, and I get really frustrated when I see students, and I see it almost every semester, put hip bone. Well, I know you know it's the hip bone. Let's learn the real name for it, okay? And so you can see here in red, we have the ilium, and we're going to learn some features on this, on the ilium. And this is what, if you feel your hip on the front, this is what you're going to feel. Okay, that's your hip, what you're going to feel is your hip. And then we have the ischium, which is this green portion down here, okay? And then the pubis here, all right? And so we're going to look at lots of different features here and learn how to label them on your sheets as well. All right, so here is the ilium, and there are lots of features on the ilium here. We have the anterior superior iliac spine. Well, that sounds really hard, but you know what? If you know what everything means, then you know exactly what you're looking for. Where is anterior? It's going to be on the front, right? Superior means it's going to be above something. Iliac means it will be on the ilium bone, and this here is the ilium bone separated, and we're looking at the frontal and the front and the back sides here. And then we have spine, and we know what a spine is, a long feature. So anterior superior iliac spine. Okay, so that needs to be on the front, and it's the one above on the ilium and along the spine, or it is the spine. And then we have the posterior superior iliac spine. So then that's going to be on the back, right? It's going to be on the back side over here on the posterior, okay? So posterior, superior, superior, all right? Notice there is also inferior on here, all right? We don't have inferior on our list, but you need to know those are there, all right? So we then have the side, well, I'm getting way ahead. Let's go ahead and go to each individual slide, right? So this is nice and simple here. We have the ilium, and we have two of them. We have a right and a left, which is this one that I'm pointing to. Is that the right, or is that the left? So here's another brief look at the anterior superior iliac spine, and then the posterior superior iliac spine. So remember to pay attention to how these particular bones are oriented, and that's how you can tell if it's anterior or posterior. Look where the notch is here, okay? And you can see that this looks like the portion of your hip bone that you can feel. So that's how you can tell this is an anterior perspective. All right, so there's the sciatic notch. The sciatic nerve does pass through there. And then we have the iliac fossa. Remember, a fossa is more like a depressed area. So it depresses in, and this whole depressed area here in green on the ilium is the iliac fossa. Then we have the iliac crest, and if you think about the crest of a wave, it's the top portion. And so you can see on each ilium there, we have a crest, and then we have the sacroiliac joint. And so this is where the sacrum, okay, and you can see here that we have the sacrum here, all right, at the base of the spine, is joining both ilium. And so this little green portion here is the sacroiliac joint. All right, and then there's the posterior inferior iliac spine. All right, so here at the base, we're going to look at the ischial tuberosity and the ischial spine, which is on the ischium, which is at the base of the pelvis here. All right, so here we have the ischial tuberosity. So you can see over here, there's a bit of a tuberosity here. And then you have the ischial spine, and this is really just a tiny little point, so it's kind of hard to see from some aspects. But I want you to notice how we're looking here. We're looking at the acetabulum, right, which is going to be one listed down here later. But the reason I'm telling you that now is because that's another ball and socket joint. So that helps you see that that's going to be the medial side of this bone. That's going to point in towards the middle of the body. Next, we have the pubis. We're going to look at the pubic tubercle, the pubic arch, and the pubic symphysis. The pubic tubercle is pretty small as far as tubercles go, as you can see in the picture there. And then the pubic arch is going to be, of course, this portion right here, and that is different for men than it is for women. And then we also have the pubic symphysis, which means coming together. And so this is a little bit of cartilage in there, and it's actually a joint. But that pubic symphysis in there. It's a little hard to see in this picture, but you can tell it's a different color. And so that is not bone, that's cartilage. But the area where that comes together, where they unite, that is the symphysis. So this is the acetabulum, and this is where the head of the femur actually does articulate with your hip bone. If you want to call it hip bone, we're in the lecture, we can. And then next we have the very large foramen, and that's the obturator foramen. And so that's on both sides. Of course, it's bilateral. It's a large opening